Hello, 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 beautiful people. It's your favorite nurse educator, Nurse Lala, and I am here to walk you through how to conduct a quality improvement project. I can't tell you enough how important it is to show your supervisor and your future employer that you have a genuine desire for nursing and you are committed to making a difference. If you follow my steps on how to implement a quality improvement project and how to do it successfully, it is sure to position you as an emerging nurse leader in healthcare. So let's get to it. I have three objectives for you today. I want you to be able to understand why quality improvement is important. I want you to learn how to create a quality improvement project. And then I want you to be able to implement a project in your work setting that is successful. And so, what is quality improvement? Well, to break it down, quality is the degree of excellence, and improvement is to make something better. So, my role here is to help you improve something in your work setting that is going to lead to healthcare and patient excellence. I am confident that you will be able to do it. Don't know where to start? No worries. I got you. So, four focus areas that you can use to do a quality improvement project. And this is from my personal experience and what I have observed in the acute care setting. So, fall prevention. Well, falls are the number one reason for patient injuries in the hospital. And then patient satisfaction. Well, hospitals are now reimbursed based on those patient satisfaction scores. Infection control. This was a good one because there's always room to improve pneumonia, sepsis, catheter associated infections, collapses, central line associated bloodstream infections. Hand washing is a big deal. Sterile technique is a big deal. Hello, we're in the middle of a pandemic. So, monitoring, um, isolation precautions, determining are they being done as safely and accurately so that we can prevent the spread even within our healthcare team? So a great area and opportunity for improvement. Discharge teaching. When I think about discharge teaching, I can't help but think about those core measures because your quality department is actually monitoring these patients extra close. Okay. So if you are in an area where you take care of patients with congestive heart failure, sepsis, pneumonia, strokes. Those are core measures. And so it's not that we're not taking care of these patients efficiently and effectively. It's more that the documentation is lacking. So this is an opportunity for you to make sure that the documentation piece for these core measure patients are being done in your work setting. All right. So, why is quality improvement important in the first place? Well, it's just the right thing to do. Okay. I would like to believe that we all became a nurse or a healthcare professional because we sincerely wanted to help people and we want to help them get better so that they can go home, right? Right. So, um, Joint Commission requires that, patients receive quality care. So they want to know that the place that you're working is a safe place for patients to receive quality patient care. They want to know if you have systems in place that contribute to quality patient outcomes. They want to know and determine if where you're working is even safe enough to even be in operation. Quality improvement is important for hospital reimbursement purposes. The less funding the hospital receives means no raises for you and I. It means an increase in our insurance premiums. It means cheap medical supplies, cuts in employee benefits such as tuition assistance and certification reimbursement and things like that. You do know that healthcare is a business, right? Right. It's a business. And so it's important for them to be able to make sure that their financial situation is balanced. Quality improvement is important because job security could be an issue for the nurse or the healthcare professional. I'm going to give you a background of a situation where I used to work, so you can have a better understanding of what I mean here. I'm not meaning a nurse having difficulty finding another nurse job. We know that those come, every day, all day, and there's going to continue to be a shortage. But what I mean is, our facility had to make some cuts in their budget for financial reasons to stay afloat. And so they made cuts in a lot of the different areas that I just mentioned. But one of the additional areas that they made some changes in was with the weekend option staff. So weekend option staff only work the weekends, and those individuals received extra compensation to do that because those were the only times that they worked. So now that they made the decision to remove most of those weekend option contracts, then it put nurses in a position of losing household income. So they were used to making X amount of money. So that forced them to be in a position to choose to stay somewhere where they've reduced my pay or try to seek employment somewhere where the pay was at or as close to what the amount of income I was used to receiving for my household. So that's the kind of situation I mean with job security. So now that you know a little bit more about what quality improvement is, some areas you can focus on, and why it's important, let's go ahead and discuss how to do it. And so I'm going to teach you how to do it using the PDSA method. This is the method that I learned from the Institute for Healthcare Improvement. They use the Plan, Do, Study, Act model. Now, in the planning phase, you want to identify the problem or the need, identify the key participants, determine a goal, not just any goal, but a SMART goal. You want to determine what is causing a problem, and then you want to develop an action plan. And so, after you determine your action plan, you're simply going to put these things into practice and start implementing them. And so, after you implement the different strategies that you're going to use to help address your issues, you want to study the progress, okay, and evaluate the effectiveness. I can tell you that I would give it at least 3 months to determine whether your project is making progress or not. And I want to call your attention that this is about quality improvement, not perfection, okay? So, progress, as small as it is progress, okay? No matter how you look at it. And I want you to think about that and keep that in the back of your head, okay? After you study your results, you monitor the progress and determine if your project is being effective. Then this is an area or a time where you can kind of make some adjustments. So if you don't see any progress being made, that's when you decide, okay, let me develop a different strategy to try to make this work. Okay. So study and then make an adjustment if you need to. If you don't, then keep being consistent um, in your interventions and see where things go from there. All right. So I'm the type of person like I can hear you tell me something, but I really don't understand unless you give me a good example. And so that's what I'm going to do here. I'm going to share my project with you so that you can have a better understanding of how to do a quality improvement project. Okay. So, with one of the projects that I did on my unit, my goal was to improve the patient care experience. And I developed this goal because, according to the patient satisfaction scores, we had issues in multiple areas. We had issues with patients not feeling confident and trusting us as nurses. They felt like nurses didn't listen carefully. They felt as if nurses didn't treat them with courtesy and respect. They felt that there was poor communication between the nurses and the doctors, of course. And then they indicated that there was lack of responsiveness with the call light system. And so, after reviewing our unit dashboard and or the NRC report for our unit, I determined that I needed to address these low patient satisfaction scores. The cause of the problem, majority was related to communication with nurses and how the nurses made them feel. And then another component of it, as I mentioned, was lack of responsiveness to the call light. Well, nurses are not the only ones responsible for responding to call lights. So it includes both the licensed and unlicensed staff. And so responding to call lights is a team effort. And so that's why both of us was included in the plan to address this particular issue on the unit. My goal the goal for my unit was to increase patient satisfaction scores from below the NRC average to meeting the standard by January of 2018. And so I sent out an initial email correspondence to communicate to the staff as a whole where we were currently and what direction we were trying to go and what we needed to achieve with our scores. And so during that phase, I considered that my opportunity to get buy in from my peers. I sent out email updates on our progress as well as I provided updates in the staff meeting. Now, you're probably thinking, well, why would you do both? Well, everyone doesn't always attend every staff meeting. So, my decision to also email our updates was a decision I made so that I can reach as many staff members as possible. Okay, I wanted to close that loop to ensure that we're all on the same page here. I also decided to do face to face in services. So, the picture you just saw on the previous slide was a picture of me just before one of my in services on the unit. I did do in services on day shift, on night shift, as well as weekends. So I created about 5 to 6 opportunities and I posted them on the unit as well as emailed those out as well. And I did have all the employees sign in for the in service. So I kind of knew who I needed to reach out to in the event that I was working with someone during a shift and they weren't able to make one of the other in services. In the downtime, I could, do the teaching with them um, while they were at work. I completed a poster presentation on the unit that really just highlighted some interpersonal skills and strategies to use to help with the communication piece with patients. I also highlighted the organization's mission and values because I felt like it was important to kind of redirect us back to some of those important principles. And then lastly, I created a couple of flyers and I posted these on the unit in the most commonly used areas. In the bathroom behind the door on the unit, I posted a flyer in the charge nurse office beside the assignment board. And then I posted flyers in both of the medication rooms behind the door. Okay, so I was very strategic in making sure that I was going to reach staff in multiple different ways. Okay. And so these are the results of my project. And I'm going to try to zoom in if I can so that you can see it a little bit closer. So my project started in after quarter 3 here of 2017. As you can see, it has multiple areas of red. And with the NRC, red indicated significantly below the standard. Yellow indicated below the standard, and then green was meeting the standard or above the standards. Okay, so we had multiple areas of red, and a lot of it was related to communication with the nurses and responsiveness to call lights and the things that I've already mentioned. And so I don't know if you can see, but you see N equals 58, 59. That's the number that indicates the number of surveys that was received um, for the unit during that particular quarter. The sample size was 59, quarter 3 of 2017. So I know a lot of people tend to say, and I see it, sometimes you really can't please everyone. Everyone is not as grateful for the healthcare staff that provide care for them. But when you see that 58, 59 people have responded and said the exact same thing, at some point you have to take ownership individually and as a team that I'm missing the mark here. It's really something that I'm not doing well, and then you know make a decision to try to make it better. And so, 59 people responded to their surveys, and we were significantly below the standards. And so, just want to draw your attention to the progression of the project. Here in quarter four, you notice some areas of red kind of went to yellow. So, there was improvement after about 3 months. Okay. And then here in quarter one of 2018, you see that some of the areas of yellow began to turn green right there in those particular areas. And so, again, making progress. And I just want to point out that it wasn't just 59 respondents and then a low amount of respondents all of a sudden to make these results better. There was 69 respondents in the quarter four of 2017 and 79 in quarter 18. And so in quarter two of 2018, we didn't have as many. And it could be, that in quarter one, maybe during the holidays, it just wasn't a whole lot of admissions and the census was low and things like that. I don't know. But for 3 out of the 4 quarters, there was at least 50 plus survey surveys received from patients. So again, overall, the strategies that I put in place, they were successful, and you can be successful as well. And so, how to be successful is just be consistent. When you develop your plan and you determine that you're going to do emails every month, you're going to do a monthly staff update, make sure that you follow up and you're consistent, because that's really, really important. And then, most of all, just be patient. Just be patient, and things will slowly start to indicate that you're doing something right. Okay. I believe in you. And so I'm telling you up front, congratulations, because I know that you're going to take this information that you've learned and you're going to implement it to the best of your ability. So, congratulations for being a quality improvement expert. Okay. I want to thank you for joining me. I wish you nothing but success in nursing and with your project. And I would love to hear from you. So let me know if how your quality improvement project goes, what you did and things like that. I would love to hear from you. So you can email me at medsearchnursingllc@gmail.com, or I'm LaQuana Smith on Facebook. Hey, shoot me a message. I would love to hear from you. Take care, like, and subscribe, okay? I appreciate it. Have a great day.